Alright, this is Crown and Bridge number 1 for skills. We are going to work on number 5. I need the Mirror and Explorer. Verify that's the tooth we're going to work on. Then we'll do anesthetic. And this time, because it's a maxillary, we need to make sure we have the right color needle, which would be red in this case. Once the patient sits and is numb, we'll use the high-speed handpiece and slow-speed handpiece if needed to remove the decay. In this case, we're going to use the diamond burrs and actually make that tooth look like a peg. Once we're done with that prep, then we need to pack the cord, pass that with the cotton pliers, and then I'm going to need the cord packer. And this is when you're shoving the cord down between the teeth and the gum tissue, and that's to cause it to separate. We're going to put a cotton roll in and let the patient set for maybe 10 minutes. After 10 minutes we come back, I'll give you the cotton roll, and then I need the cotton pliers back to remove that cord now. And we're going to prepare for the impression. The dentist gets the impression that has the fine tip on it while the assistant is loading the tray. I am squirting a material down where that gum tissue just separated from the tooth. And then the impression tray will go in, and they will bite down on that and keep their teeth together. When it is done, you take it out, and we will disinfect that with the Cavicide, and that's what's going to go to the laboratory to make that crown. At this point, we need to make the temporary crown. We will use the acrylic burr to help make that temporary crown. When the temporary crown is done, we will cement it in with temporary cement or temp bond. And then the last step is to take a shade. If we're doing a porcelain crown, we want to make sure it matches. The lab is going to need to know that. And then lastly, we need to tell that patient when they have a temporary crown not to eat anything sticky, no gum. And when they floss, they have to floss down and then pull it out. They can't come up and down with their floss or they'll pop that temporary off. If the temporary comes off, we want to see them again, because if the temporary is off for any extended period of time, that permanent crown may not fit. So that is Crown and Bridge number 1.